record here. Well, thanks for joining us for our Dairy Goat webinar series. My name is Jennifer Bentley, and I'm a dairy field specialist with ISU Extension and Outreach. And I have some colleagues on here today. My colleague from Southeast Iowa, Larry Tranel, and my colleague Fred Hall from Northwest Iowa. We're a dairy field specialist here in Iowa. So this is part of our Dairy Goat webinar series. If you've been following along, you know this is our fourth webinar. And after this webinar here in April, we're going to take a little break. So we're not going to have a webinar in May, June, July, and August, but we will be back in September and finish out the year with the monthly webinars. So you'll get an updated reminder when those come back online here in September. But we're happy to have with us Dr. Roselle Busch here today to talk to us about health challenges in dairy goats. And so I want to welcome her to our Dairy Goat webinar series. I know she's been on our webinars here in the last couple years as we've been focusing on dairy goats. But I do want to just take some time to introduce her. Dr. Roselle Busch is a sheep and goat extension veterinarian with UC Cooperative Extension and the UC Davis School of Vet Medicine. And she received her DVM from UC Davis. She practiced in a rural mixed animal clinic in Hollister, California, before returning to UC Davis to complete a residency in large animal internal medicine focusing on livestock. She has years of practical experience working in the livestock medicine and surgery service, veterinary medical teaching hospital, teaching students and residents. Dr. Busch then went to work for the California Department of Food and Agriculture with a team of scientists developing evidence-based resources for vets and livestock owners on antimicrobial stewardship. And as an extension veterinarian, she is currently collaborating on a number of studies looking at practical approaches to improve young stock survival and maternal health and productivity. So with that, Rosie, I think I'll turn it over to you and allow you to start your presentation on health challenges in dairy goat kids.
Great. Thank you so much, Jen.
All right. And I think while you're doing that, Rosie, I would do those poll questions if you want to start off with those.
Yeah. Should I share my screen and then you can do the poll questions with that? Okay.
That'd be good.
Okay.
Yeah, so we do have a few poll questions that we wanted to ask our audience before we did go ahead and get started with the presentation. So I'm going to go ahead and launch those here. So the first question is just asking for those that are milking goats, how many you are milking. So go ahead and fill that out there. Looks like we have about 30, almost 35 participants online here today. I know we always get a range of number of goats being milked here. So as you're entering those in, it looks like we got about half of our participants that have participated in the poll. So I'm going to go ahead and end that. And so you should be able to see those results, right? Rosie or Larry, can you see those?
Okay. Yes, we see them. Yep.
Yep. So it looks like we got about 60% of our audience here today that does not milk goats. So maybe they're working in the industry or veterinarians, extension educators. But the rest that are milking goats are somewhere in that 1 to 10, 11 to 50, a few in the 51 to 100, and a few in that over 200. So my next question here, I'll close that, is so how do you raise your kids? Do you snatch rear, so artificially raise your kids immediately after birth, yes or no?
I'm realizing there should be a not does not apply option for this.
Yeah.
Oh, well.
Yeah, so I guess if you're actively raising kids, yep.
Yeah.
And we'll go ahead and close that one out. So it looks like we're just about split there. So 45% yes, 55% no. And a little bit on colostrum management. This has 2 questions. Do you use heat-treated colostrum? Yes or no? And do you use powdered colostrum? Yes or no? Some of these questions will help Dr. Busch as she's presenting here today as we talk about some of these health challenges in our dairy goat kids. So that's good to have that understanding of what our audience is doing. Give them a few more seconds there. So it looks like for do you use heat-treated colostrum? Majority are saying no, and then a little bit split or more split on the do you use powdered colostrum? About 40% yes, the remaining no there. I believe I have one more question. So our last question, and this is something we'll discuss today during the presentation. Did you know or are you aware that all antibiotics will require a prescription from a veterinarian to be used on farm as of June 2023? So this will be our final question before we get into the presentation here. And I'll go ahead and close that. So the ones that responded, we got 100% are aware. That's good.
All right. Yeah. Okay, cool. Well, thank you everyone for doing that. Like Jen said, that really helps frame the rest of the program. So we will be going over kind of just the basics of kid management. There is a webinar that we did maybe a year or two ago on neonatal management, kid rearing. So this is a little bit of a review of that. So we'll go over it quickly. If you want more information, that webinar is available on the Iowa State Dairy Extension website with the Dairy Goat program. And then we'll look at what a herd health program means, and then we'll go over some common diseases. Now, there's going to be quite a bit of information there, so hopefully this can be a resource that you can use. It's meant to be help kind of create awareness of some of these diseases so that you can have protocols. Some of them are very common, as it says. And then we'll talk about potential vaccine programs and records. All right. So before we even get to the status of kid health, maternal nutrition and health status is so important. We want to make sure that her nutrition is not only, you know, optimal at the end of pregnancy so that she has strong, healthy kids, but also it's really important for early lactation, for colostrum quality, for milk quality, things like that. Her disease status is also really important for those things as well. And then also her vaccination status. And these help, knowing her disease status might change how we manage the kids that are born from her. And we'll talk about specific examples of that. Vaccine status will help us with what antibodies might actually be in the colostrum. So if we're vaccinating pregnant does, then the antibodies that she creates to those vaccines will then be available to the newborn kids if we're making sure that they get that colostrum. So kid health really starts with a good, strong, healthy doe. Housing, we can have a variety of housing setups. So we can have permanent housing, we can have temporary housing, especially for kid rearing. Might make sense for them to be portable or temporary so that we can really effectively clean under those areas. And then depending on the location of the farm, shelters may be really critical, especially if we're feeding only 2 times a day. They're not getting that frequent suckling that can help keep their metabolism up, keep their body heat up. So shelter can be really important in those situations for newborn kids. Um, again, this is all reviewed in that one webinar, but one method of kid rearing that has really helped with minimizing exposure to disease from adult does, and then preventing disease from occurring it's called snatch rearing or artificial rearing. And it's more than just immediately separating them, but that's part of this is making sure as soon as they're born that they don't have a lot of contact with that doe, so that they're not able to contract whatever diseases she may have. And so these are, can come in a number of forms, and this is where we're making sure that they're healthy immediately after birth. And then those litters can go into condos. You can, as they get older. So typically in these boxes, we have about 2 to 4 kids. They can stay in here for up to 2 weeks. And then as they get older, we'll combine litters into larger kid cohorts that are the same age. We want to make sure that they're warm and dry, and are sheltered from the elements, but we also want to make sure they have enough ventilation is really important. These kid groups at 2 weeks of age typically have about 10 kids, and again, they're grouped by age, and then if possible, by size. You'll see some of these kids, if they're, with quads or quintuplets, they can be a lot smaller than the singles or twins, and they tend to be bullied. So in order to minimize competition, we want to help them learn how to use feeders and gain strength. And so we'll wait to combine those cohorts until they're a bit older. Enrichment is something that we're actually, there's a couple of researchers at different universities that are looking at what might be important for future success for these kids, if it's important to encourage play behavior, different climbing behaviors of, we've seen some kid pens that have stumps and things like that, areas for them to run around. So there's more to come on that. And then space recommendations, especially when they're getting into groups where they're limit fed, whether it's milk limit feeding, or they're being fed grain and pellets, and it's only a couple times a day, and they're being fed an exact amount. Those types of systems require all the animals to have access to that feed at once. And typically that's about 9 to 12 inches per head is the recommendation. An ad lib feeding situation where they have access to feed all the time. So those automatic nursing machines, you have feed that's available all the time and refreshed, then they would require less space per kid. And the recommendation is usually 2 to 4 inches per head. Waters are a bit of a challenge. For kids, it's not recommended for them to be deeper than 12 inches. It's really not recommended to provide water in that first week of life because it can be really confusing to tell which kids are actually nursing. They'll feel full, but look pretty dumpy, and it may be even those that are doe rearing, you'll see them suckle and they'll feel full, but they may also be drinking water. So that can be a bit challenging. That may be where in those types of situations, if we are doe rearing, we want to raise the water so kids don't have access to it. But by about 1 to 2 weeks, they should have access, especially if they are foraging with their mothers, then water is really important. But if it's deeper than 12 inches, we have the risk of drowning. And again, so the amount of waterers per pen, they say, is about 1 water tub per 50 to 75 head. Unfortunately, it didn't say how big the tub is, so I'm imagining that's like an automatic water or something that refills all the time. And then ideally, it's at a level that minimizes fecal and urine contamination. So some of the waters have covers so that they can put their faces into an area, but then most of it's covered. So if they stand over it, they're not able to urinate or defecate into it. But I have not seen a perfect design for one of these yet that is available for both does and kids. Um, all right, so colostrum is going to be a really important part of this, especially for herds that maybe have a level of diseases that we'll talk about, these chronic diseases that we don't want passed through to the next kid crop. Um, so a heat-treated colostrum will help reduce, or if anything, eliminate transmission from those diseases, including CAE, Johne's disease, um, mycoplasma, and honestly, so heat treating colostrum was initially a practice developed for eliminating transmission of mycoplasma. And then lo and behold, all these CAE knees or arthritis goats disappeared. So, or started, we stopped having them. And that was before we even really knew what CAE was. So initially we started heat treating colostrum for mycoplasma. This is maintaining colostrum at 135 degrees for 60 minutes. And it's really important. So these new sous vide or sous vide, I can't never pronounce it, devices help maintain that temperature for a prolonged period. It used to be we were putting pots on propane burners and things like that. It's really challenging to maintain that temperature. So there are new tools now that help maintain that temperature. But what's really important is that the internal temperature in those jars are at 130 to 135 for 60 minutes. So we do want to make sure there's a thermometer in there, and once that reaches 135, then we start the timer. A next ideal source would be a heat-treated cow colostrum. Colostrum replacers are okay. There are no studies in goats, as far as I know, that look at the efficacy of colostrum replacers. So I know there's a number of folks that have varying opinions about them, but they're probably better than nothing. So colostrum supplements are not a great option because they have very low levels of IgG. So they're meant to help supplement if you have a kid that's on a doe, but maybe she doesn't have great colostrum, and so you would supplement with this product. But it's such low levels, they don't tend to be really high quality products. All right, and then again, you can find exactly how we want to do this with these resources. Milk, again, if we're artificially rearing for disease control purposes, if we're feeding whole milk from our goats, we want to make sure it's pasteurized because these diseases are not only transmitted through colostrum, they're also transmitted through milk. So this is where we would pasteurize, and that is not the accurate pasteurizing recommendations. I apologize for that. And then pasteurized cow's milk as well is the next best source. And then milk replacers. The thing with milk replacers is you would ideally look for a milk replacer that has milk fat, milk protein, and lactose as the ingredients. Pretty challenging to find, but there are definitely some out there. All right. So there are different ways to artificially rear. So we can do these lamb-bar systems. They can be limit fed, so they're fed exactly the same amount, or exactly what you want them to be, depending on what type of weaning program you do. Or there are these automatic machines that they can go as often as they want. They're at a temperature that you set it to, so warm or cold, depending on what some of the challenges you see. So if you see a lot of kids overeating on it, you might reduce the temperature so that they're not as likely to gorge themselves on that milk replacer or whatever milk's in there. Usually it's milk replacer. All right, so those are some of those management practices that can help us to start with a healthy kid crop. Herd health programs. So there are a number of things that we can do to try to prevent some of these diseases. Well, we ideally, we want to learn how to recognize and treat diseases that occur. Veterinarians can help us confirm what diseases we're seeing and determine the cause. And that really helps us focus in on what type of management changes we might want to make in order to prevent this from happening in the future. It can inform an annual management calendar or schedule. So there's things that we know we don't miss, and so that we can really optimize the health of our kids. And then it can also inform disease protocols, or treatment protocols. So things that you're gonna, you anticipate seeing. Hopefully, you've put in your prevention, but there's no such thing as a disease-free herd. So we can do our best, but animals get sick. And so we wanna have treatment protocols in place, especially when we can't just go to the feed store and get the antibiotic that we need or order it from an online pharmacy. We need to communicate with our vet about what we're seeing and have these protocols in place ahead of time. All right. So part of that, your vet can help you if they haven't already, confirm what vaccines would make sense for your operation. CD&T would be like the one core vaccine that really ought to be given every year. The kids require a series of two in their first year. And that when that's initiated really depends on when the does were vaccinated. So if the does were vaccinated in pregnancy, then the kids don't have to have their first vaccine until they're about 4 to 6 weeks old. If the does were not vaccinated, then most people will push that up to about 2 weeks of age. Hoof care needs to happen quite often on goats. And then things like doing body condition score and famachas and clipping and udder hygiene and things like that are also important to add into your annual care program. All right, so we've, again, herd health plan. So coming up with how we're going to manage colostrum, how we're going to ensure the kids get colostrum. Are we dam raising or bottle raising? What's our housing system going to look like? When are we moving them into different groups? Are we grazing them out in pasture? How are we deciding to move them? What's our kind of plan for all of this? Not only for nutrition, but to minimize disease exposure. All right, and then what procedures are going to happen with the kids after birth? So all things that it would be good for the vet to know and can help you with some of your management deals. So how to spot trouble. Monitoring every day is critical. Monitoring them when we're feeding is really important. So that's one of the drawbacks, I think, with these automatic feeders. They're incredible from a labor point of view, but we don't see them go to the feed. We don't see the ones that hang back. So you do have to have a really sharp eye if we're using those systems to be able to catch the ones that are not thriving in those situations. And again, we want to catch them early so that those kids have success. So they're prey animals, they're pretty stoic. Goats, maybe of all the livestock species, are a little bit less stoic than others. But so important to know in your system what normal behavior looks like, what group behavior looks like. And then really important to have experience with doing a tip to tail assessment. So what does a normal goat look like from head to toe? What's a normal temperature? All those things to become familiar with and have in your plans. All right, so when we start seeing disease, usually what we see is clinical disease, and that's kind of the tip of the iceberg. So we see signs, sometimes they're non-specific signs, like it's not eating or it's down. And those tell us something is not right, but it doesn't tell us exactly what it is. Sometimes they seem to be specific signs. So we have goats that are, or goat kids that are breathing rapidly. It makes us think pneumonia, but unfortunately, when we have things like floppy kid syndrome or diarrhea, it makes them breathe rapid because their acid base is off. So they're trying to blow off all that acid. So really important, like I said, to be able to, know how to do that tip to tail assessment to try to identify what the problem is in these animals. And like, you can learn a lot from your veterinarian and trying to differentiate those problems. Um, Clinical disease certainly can cause animals to die. And we'll talk about, the importance of doing necropsies with those to help us move forward and learn from all these cases. Um, when there's clinical disease, usually there's subclinical disease. So there's animals that have these pathogens or infections, and we haven't spotted them yet because they're not showing any signs. Their production hasn't changed at all. Um, they're growing, maybe not as well as the others, but yeah, maybe they're just failing to thrive. And maybe that's something we'll measure if we take birth weights and weaning weights or something like that, or if we're able to identify how much they're actually eating. These subclinical infections can have impact on their future performance. So even if they're affected as kids, it can greatly impact their ability to produce milk in the future. And especially can increase their susceptibility to other diseases. All right, so I love this quote. This is from a mentor from a long time ago that says, we miss more by not looking than by not knowing. So really so important to monitor your animals every day and find a way that that works for you. What is that thing that, if it's not feeding, it's something else, moving them, getting in there, walking through them, really important. Okay, so we have different types of diseases, whether they're endemic, so they kind of be chronic within the herd maybe, or disease outbreaks. And sometimes that happens because we had a change of management. We have new animals being brought into a herd, or new strains of pathogens that evolve. Or sometimes we have vaccines that didn't quite work for various reasons. Um, so that's where working with your veterinarian can really help identify some of the risk factors that have led to some of these disease challenges. Um, first looking at unaffected animals and seeing where they're living, what's the difference between those and the affected animals, and then looking at sick animals. Um, all right, and then field necropsies are always valuable, especially if we're far away from state diagnostic labs. I know that is a challenge. Definitely want to impress that field necropsies are valuable. You can get a really good idea of what systems affected, maybe even what type of disease might be going on. But for things like enteritis, really hard to know exactly what's causing that disease, or even polyarthritis, what bacteria is affecting them, pneumonia. What is the primary problem here? So even if we can find a system organ system that's affected, that might help us identify what management practices need to be changed immediately. But still a good idea to take samples of those and ship them to your diagnostic lab. There are some state labs take multiple samples, and they can be sent together and they can be submitted as a field necropsy, which would get the same sort of treatment as if you were to send the whole carcass. So something to look into. I think there's a lot of value with that. All right, so disease control biosecurity is incredibly important, especially depending on what type of kid rearing program you have. So, if we have if we want to, especially if we are doe rearing our kids, keeping everyone together, we want to be testing. So try to screen all the new additions. Sometimes it's challenging because they're not in lactation, so it's really hard to know what types of bacteria they might have in their udder. Important ones to screen for would be things like Staph aureus, Mycoplasma, and obviously the things that we can test on blood being CAE and Johne's disease and even CL. Um, so other things to consider is if we do have disease in our herd, can we manage diseased animals separately from non-diseased animals? So whether, if it's just new additions, having isolation pens until all of our test results come back and we make sure they're not sick. Or if we're trying to go through a process to try to eliminate disease or reduce the amount of disease, is there a way we can manage some of these animals separately? Hygiene and sanitation is incredibly important when rearing kids. They're brand new babies. Having them in a clean, warm, dry, and well ventilated environment is really important. And then with that, traffic control. We kind of already alluded to this in some of the things, but we want to make sure that the people and the equipment that are with the kids are clean. And when we're looking at kids, we want to go. So the idea is to go from the naive animals, so the healthy animals, to the diseased animals. So when your vet comes on farm, they're going to look at your healthy kids first, and then your sick kids. And then we're going to go up to the older kids and then go to the older healthy does and then to your sick does. So we want to go young to old. And then if we have new additions, they're going to be absolutely last. Cleaning and disinfecting, most of that process is the cleaning part. We can't rely on disinfectants to do all the work of eliminating, a lot of the, manure and things like that. Just spraying it with a disinfectant isn't going to reduce that risk. So we do really need to clean our pens, which is why, again, it might be helpful to have pens that are movable so you can get in there with a skid steer and just scrape it out. So something that is manageable and, helps with the labor that's involved with kid rearing because it can be quite labor intensive. And then kid rearing, especially with the process of kidding, can be one of those high risk times for human health and safety. So we do want to make sure that people have access to gloves, protective clothing, and boots, and maybe masks because some of these diseases can be airborne to people. And a lot of this too, maybe the person's healthy, but they're going home to their children or they're going home to where they live with their parents that are older, and it's immunocompromised people have most of the risk, or pregnant women have a lot of risk to some of these diseases. A normal human can get sick, but usually a lot of the diseases cause flu-like symptoms. It's mostly immunocompromised and pregnant women. So someone with cancer treatments and things like that, that really should be careful. So the reason for personal protective equipment is not just for the person working with the animals, but so they don't bring these things home to the people that may be at risk of acquiring infections like toxoplasma, Q fever, salmonella. So really important to be aware of those and protect our families and communities. All right, so on to the meat of this presentation. So the common diseases, and I've added a few more in here, but we'll talk about so we have hypoglycemia and hypothermia. Usually we think of those as being a lack of calories, right? So we can have hypoglycemia, obviously they're not nursing, so they drop in blood sugar. Hypothermia can be they're not nursing or the elements are too intense. And sometimes that can be, you know, if they're outside and it's really stormy at night, even if they were healthy the day before and nursing, if it's really that stormy, sometimes does don't want to stand in the middle of a storm. They want to stay kind of bedded down. So if that's the case, if that's how we're rearing and we don't have access to shelter, really important to get out there in the middle of the night, in the middle of a storm, and make sure everyone stands and the kids have access to nursing. Naval ill, we typically think of as an environmental problem. So contamination, hygiene, um, diarrhea, they can get diarrhea, so they can get E. coli and salmonella from contaminated milk. They can get diarrhea from pathogens that are in their environment, E. coli and things like that. And then they can get it from just straight animal contact. They can have it from colostrum in milk, especially if we'll talk about this in a little bit, but mixing milk replacers. Um, Pneumonia can be from like aspiration pneumonia, from feeding systems, from the environment, depending on what our ventilation looks like. Um, Huge fluctuations in temperatures certainly don't do us any favors with pneumonia. Um, and then for our chronic diseases, oh, sure. So nose to nose contact. Chronic diseases, again, colostrum in milk can help transmit those. Uh, Yonis in the environment, and then animal contact. So when we talk about diseases, it's not just the pathogen. So, you know, sure, E. coli and salmonella, they're pretty gnarly diarrhea causing. Sometimes they get full blown sepsis where they have an infection all throughout their body from these bacteria. But those can be managed by managing the environment, right? So just because we have a pathogen present doesn't necessarily mean that all of our kids are going to get sick from it. So there are ways to manage this with environmental management. And then the host susceptibility. So if we have a doe that has good colostrum quality and that kid ingested a good amount of colostrum, then its susceptibility to these diseases are going to be lower too. But if it's loaded with an environment that has a lot of these bacteria and a E. coli that is really pathogenic or really nasty bacteria, then even if it had colostrum, that can overcome the immunity, the passive immunity that that kid received from its dam. So all these things come into play. Just giving colostrum isn't the golden ticket to protect it from disease. We do have to consider these other factors. All right, so hypoglycemia, hypothermia, typically in newborn kids, depending on the environment, we can see this in kids that are up to a week old. Usually after a week old, they're a bit stronger. If we're having crazy blizzards and things like that, sure, we can see this in older kids that are weak because they have pneumonia or weak because they have scours. So usually when we think of hypoglycemia and hypothermia, they typically go together. Usually what you see is a hypothermic animal. They don't even register on the thermometer. And that we would call, if they're less than 6 hours old, a primary hypothermia. You'd want to warm them till they at least register, and give them a warm energy source. Because they're primary hypothermia, it's still critical that they get an energy source. Usually we want to give them some kind of dextrose, and that can be given either IV, it can be given intraperitoneally, which is something your vet can teach you how to do and how to mix up the sterile solution to do that, which is kind of neat to have available to you if this is a common thing. If it's not common, then I wouldn't necessarily worry about having that, training for that. But if you're in a cold area and you do see a lot of hypoglycemic, hypothermic animals, knowing how to give intraperitoneal dextrose, 20% is really a great skill to have. And then with that, once they are warmed up and they have a suckle, then we like to tube them with some warm colostrum. If they're older than 6 hours, usually it's a primary hypoglycemia because something has kept them from getting up and nursing. So whether that's pneumonia, like I said, or scours, or it's just really cold and the doe doesn't want to get up, and so it's not getting up. Sometimes they have arthritis, so they're too painful to get up enough. So those are kind of similar. We'll warm them until they register, and then it's critical to give them that energy source, especially we can't rely on their gut. If we're just tubing them with warm colostrum, their gut isn't functioning really well at this with this type of hypothermia. So we really do need to give them an energy source, IV or intraperitoneally. Um, so a good protocol, if it's common, to have developed with your veterinarian. A lot of those kids may have been a failure of passive transfer. They may benefit from some antibiotics, especially if I'm giving intraperitoneal. I give them antibiotics. All right, to prevent secondary infection. So navel ill, we typically see anywhere from newborn to 2 weeks old. Often these guys have failure of passive transfer. It's a bacterial disease. Sometimes you'll see just an umbilical abscess. Sometimes we'll see swollen, painful joints, and you can see those really soon, within a week. And then sometimes we'll see liver abscesses. And again, this is, not even a 2-week-old animal. Pretty extensive liver abscesses. And so typically we think of this as being environmental. So, we're not dipping navels, or what we have to dip isn't, if it's not drying the navel. So usually we think of like 7% iodine, which is really hard to get and it's a controlled product. So it has to be in a locked container. Those dry the navel really well within a couple hours. The newer products that we have, like chlorhexidine and then the weaker iodine, they don't dry it as quickly. They're really effective at disinfecting, but if that navel is still wet, then it needs to be dipped multiple times in that first day. So every 6 hours, you would dip the navels. Pretty hard to do on a larger operation. So important to make sure if we're seeing these, let's really assess what our navel care is when they're born. All right, floppy kid syndrome. So typically these kids are born healthy, they look great, and then a few days after birth, they go downhill. They look really weak. They do that kind of like dying kid call, and they don't have a fever. They don't have any sign of diarrhea yet. We don't really know the cause of this, but it's assumed that it's related to overconsumption of milk. The herds that see this have either recently increased the nutrition for their does, so now the does might be producing more milk, or they've brought them into a housing environment, so they're not walking out on pasture as much anymore. And so because the kids have access to nursing the does more, and so they're probably again over consuming milk. So that milk that sits in the abomasum, on necropsy, they'll see these giant abomasums that are full of curdled milk. And it basically ferments and creates acid, which causes that depressed behavior. So really, the way that this is being diagnosed is by taking a venous blood gas, so a blood sample, and seeing what pH its blood is. But if you don't see any other signs like pneumonia or scours or anything, chances are this is what this is. Like we said, with these other diseases like scours and pneumonia, they're not eating. So our initial, point of care is to get energy into them and tube them. With this one, because it's related to overconsumption of milk and they're so full of milk, tubing them actually makes it worse. So the treatment is to take them off of milk for 24 hours, which is really hard to convince people to do because they look like they need energy. But the important thing is to correct their acid base. So ideally, if you've got a veterinarian that can be there and measure what its base deficit is, take the blood sample, find out that it's acidotic, and then correct that with IV fluids. That's probably best case scenario. But for folks that have, maybe further away from the vet or other things, there are other ways to get isotonic bicarb into the animal. Again, probably a really good idea to have this protocol developed with your veterinarian, but that can be given intraperitoneally, isotonic bicarb. It can be given orally with baking soda, mixed diluted baking soda, so about a teaspoon to 8 ounces of water. Not giving the full 8 ounces, only giving about 10 to 20 mils orally a couple of times. And again, really important to discuss this with the vet. There are thoughts that maybe giving antibiotics to these guys is important to prevent secondary infections because that milk's just sitting there. That usually the gut lining is a bit compromised because it's been in an acidotic environment. So there might be some bacteria that have crossed that gut barrier. But be a little bit, I think that's where it's important to talk to your vet is that, we don't necessarily want to use the strongest antibiotic we have because part of the problem that will follow is this undigested milk coming through the back end. So a lot of these animals get diarrhea after recovering from this because they have undigested milk making it through the gut, which you want to see things moving. Diarrhea, seeing poop is fantastic. But if we're giving, Nuflor, something that's extremely broad spectrum, a great antibiotic, we're also going to be changing the microflora or the bacteria that live in their intestines. So we want to be a little bit selective, maybe base it off of what types of bacteria we tend to see with our enteritis, or, the polyarthritis type deals. So, but again, is if you see this, something that would be good to develop a protocol with your vet to help manage those on farm. Diarrhea, we can really see at any age. And a lot of these might be associated with a failure of passive transfer. And I don't know if I've defined that yet, but failure of passive transfer is basically not getting a large enough quantity of colostrum, which was that 20% of body weight in the first 20 hours, or the colostrum that they are receiving isn't good quality. So, there are ways to measure the IgG content of colostrum, not super easy to do on farms. There's colostrometers, but goat colostrum can be really dense. So those aren't as accurate necessarily. But that said, there are first freshening doughs that may have lower colostrum quality. So important to kind of keep that in mind. There are ways to manage colostrum quality. Some people will pool colostrum and then heat treat it so that they're able to get sort of an average. But that said, you're going to take your really good colostrum and make it a little less good because you're putting in colostrum that isn't as good to start with. So, if we're seeing a lot of these different diseases, not like low levels, the chances, but a lot of them, then that would be a good place to investigate. What's our colostrum quality kind of across the board and how can we better manage colostrum? So there are viral pathogens that cause diarrhea like rotavirus and coronavirus, and there's others as well that can be found in that first few days. So usually this is within 5 days, seeing viral diarrhea. Bacterial, E. coli, again, is usually pretty early. Salmonella, they can get salmonella diarrhea at any age. So that can be where it's helpful. And then, there's clostridial diseases that cause diarrhea as well. They can affect the abomasum. So that's where, we may know that we have scours, but this might be important to actually dial into what the cause would be. unfortunately, antibiotics don't usually help resolve the diarrhea, but if the bacteria are causing enough inflammation in the gut, that bacteria can then cross that gut barrier, cause secondary infection. So that's where antibiotics may be helpful to prevent, sepsis or infection of the whole goat. But really supportive care is necessary, and we'll talk about that next slide. So treatments include keeping that animal warm and hydrated, and then replacing electrolytes, and then acid-base correction. So we don't want to completely remove milk from the diet, for especially with diseases like crypto and things like that, which we'll talk about. Well, I don't talk a ton about crypto because I used an example in the last webinar, but um, crypto is actually inhibited by the fat in milk. So if we just removed all the milk, then we're actually helping, like, improving their environment for survival. So, and aside from that, if we remove milk and only kept them alive on electrolyte solutions, the small amount of dextrose that's in electrolyte solutions is not enough to feed them. So they will lose weight, they will lose energy. Um, but the challenge is if we feed oral electrolytes at the same time as milk, then we're diluting that milk and the milk doesn't coagulate normally. So we have undigested milk going into the hindgut where these bacteria, are causing problems, and we're just providing them an energy source. So we want that milk to coagulate in the abomasum. We want milk in the concentration it's meant to be. Give it a couple hours, 4 hours, 2 hours, and then we can give our electrolyte solutions. So usually we'll stagger those. If we're feeding milk 3 times a day, so every 8 hours, then in 4 hours after milk feeding, we'll do our electrolyte solution. Um, I don't usually like giving electrolyte solution in a bottle because I don't want them to get used to taking water or anything like that out of a bottle. I want the bottles just to be feed related. Um, but yeah, so if again, and then with so electrolytes can usually be done orally, whether it's bottle feeding or tube feeding. Um, the acid base correction, kind of like what we'd talked about with the floppy kid, can be done IV, can be done intraperitoneally, or can be done orally. Challenge with orally is that a lot of times with these scours, their guts aren't functioning totally well, but it's, we're giving electrolyte solutions orally. So if that's the option that works best for us, then it's great. So for fluids, if there's a suckle present, um, usually we're doing either a bottle or a tube. If they don't have a suckle, that's when it's really important to not tube them, because they're at risk of regurgitating. And so either IV or intraperitoneal fluids are best. All right, so Clostridia causes enterotoxemias. We'll see bloody scours or pulpy kidney disease, and it causes tetanus. This is a lamb. Usually we'll see tetanus after they've done tail docking procedures. We can see tetanus after disbedding procedures, castrations. So really important disease to consider. One of the reasons why we like vaccinating does in pregnancy so that they are getting passive immunity to these pathogens in their colostrum. But they have to have that colostrum in order for this to help us out. So it can be, this bacteria is everywhere in the soil. So, saying I don't have Clostridia, it's in the environment. It's everywhere. It's on, the rusty nails and all those things. It's everywhere, the things they chew on. So it can be orally inoculated or by injury, and we can cause those injuries like by doing castrations. All right, so this is that wild crypto example I do in the other webinar, but basically showing how critical it is to have either kid groups that are separated by age or moving does and kids, within 10 to 12 days, or like keeping them in kidding. I mean, sometimes if we're pasture rearing, we're not having separate kidding groups. But basically minimizing their exposure to this parasite is critical, because these first kids, let's see if I can summarize this, but we've got an adult doe. She's got a little bit of crypto because adult does have parasites, just not enough to make them unhealthy. But it is enough to give an exposure to the first kid that's born. Um, as little as 10 oocysts can cause an infection. And then within 10 days, they're shedding 10,000 to a million oocysts. And then they can reinfect themselves, they can reinfect new kids. So imagine this kid was only exposed to 10 oocysts. Now this kid is exposed to millions. So you've got a huge infectious dose with naive kids. And so then you get usually clinical disease. And if they're reinfecting themselves, it may be too high of an infectious dose because, again, it's only 10 days. They haven't really amounted a really good immune response. So, which is, having that exposure, that minimal exposure and an immune response is okay. So, like, but ideally, we can control that by eliminating the re-exposure. And then these kids that are exposed to huge amounts. And we can manage that by having, if we're doing artificial rearing, so kids grouped by age, that'll help because these guys that do get exposed, if they're shedding large amounts or they have scours, we put them in a hospital pen. Then they're not exposing all the naive kids around them, or the newborn kids around them. If we're managing everyone together, really important to move them before every 10 days. So they're not constantly reinfecting themselves or that place that they've just, shed all their millions of oocysts. We can move off of that part of the pasture onto a new one. So this is where strip grazing might be really helpful during kidding. All right. So for coccidia, we typically don't see coccidia until about 2 to 5 months old. Gosh, I talk way too much. I'm about to. So coccidia, we won't worry about. Nutritional, we can see in all ages. So mixing problems with milk replacer, poor quality milk replacers, depending on the fat source, the fat alone can cause diarrhea. So, we want to. It's challenging. There are definitely like coconut oils and things like that that they seem to do okay on. But depending on the fat and the sugar source, if they can't digest it, it's just going to go into their hind gut and cause, give energy to the bacteria that are there. And then we've talked about these other things. Other nutritional problems you might see in kids are like white muscle disease, which is a selenium deficiency, and then enzootic ataxia, where they do the bunny hopping. We usually don't see that until they're like 4 weeks old or older. All right, pneumonia we can see from aspiration, poor ventilation, usually again associated with failure of passive transfer, or stress caused by shipping, weather extremes, all that. I say difficulty breathing, and remember that animals with scours can also have this. So pneumonia is something you'll want to have a treatment protocol with. It's going to be a common thing you'll see, and you with your vet can decide what the best course of antibiotics would be. Really want to hit on some of these chronic diseases that we can control with artificial rearing. Mycoplasma, like I said, was the initial reason why we started heat treating colostrum, causes polyarthritis in kids, pneumonia in kids and does, otitis in kids. So you'll see kids with neurologic disease and then chronic mastitis in does, reduced milk production. So it's transmitted through colostrum and milk. Does can give it to each other from nose to nose contact. And then even if we are managing a mycoplasma positive string separate from a negative string, if we don't wash our milking lines between, or we don't have great vacuum pressure, or like if our milking system isn't top notch, we can transmit mycoplasma. So obviously we should be milking the negatives before we bring in the positives. But that is an important place to look to if we're still having transmission occur. Um, Mycoplasma is reemerging because we've gotten so good at testing for CAE that we think, okay, well, we don't have CAE anymore, so we can stop pasteurizing colostrum and stop pasteurizing milk. And now we have mycoplasma outbreaks in herds. So really important to, if you're starting to see these things pop up, reconsider the pasteurized milking or pasteurized milk and hot heat treated colostrum for your kid rearing program. And that's true for doe raised animals. When we're, if we feel really good about our kids nursing off the does, if we have, because we've tested for CAE, Yonis, and CL, we also want to make sure we're testing for Staph aureus and mycoplasma in milk. We may need to take a couple milk samples at early lactation and late lactation to really know what her status is, because those bacteria tend to be shed at different times of lactation, which is super helpful. But also know that mycoplasma, we can't grow off a typical blood agar plate. So you have to ask for them to do a mycoplasma culture. CAE, again, we know a lot about. We've done webinars on this. Important to control. Johne's disease, really challenging to control when it's in a herd. So as much as we can to prevent transmission, this is where if we do have Johne's disease, snatch rearing really helps create a negative herd, because we're minimizing the transmission from a positive animal in that environment to a naive animal. The challenge is environmental contamination. We have to make sure we clean and disinfect really well for these naive animals. CL, I think we tend to tolerate it quite a bit. This bacteria causes internal and external abscesses, and these internal abscesses just, you might have more preg tox than you ever think you should. If your nutrition management is great and you're seeing all this preg tox, they may have livers that are riddled with abscesses, so their liver metabolism capacity is greatly depressed. You'll see poor growth, weight loss, and then it's transmitted from respiratory secretions. It can be transmitted from direct contact, environmental contamination. So there is a vaccine for CL. It's pretty rough. So if we're giving it, we want to make sure it's not, they don't have a big job to do the next day, like we're not breeding them the next day. So because it does create a bit of inflammation. But usually the vaccine doesn't eliminate the disease, it helps reduce shedding. So you might see impacts of this vaccine years down the road. The other alternative is, if you see animals with abscesses, isolate them, let them, lance that abscess and catch all the material, let them heal completely before reintroducing them into the milking herd. So just being really cleanly and conscious about this disease can really help minimize spread and exposure within a herd, and especially within the environment. All right, I know I'm going over. So some of these slides, want to make sure we get to vaccines. Like I said, the core vaccine is CD&T. And there are a number of other vaccines that exist that people want to use, some that I haven't even added on here, some that are labeled for goats, so like the abortion vaccines may have a goat label, but you may not need them. So it's not, we don't have to vaccinate our animals for everything. This would be a good conversation to have, amongst yourself and other producers with your veterinarian. If we are using vaccines extra label, you do have to have a veterinarian, overseeing the use of that. The vaccines don't require prescription, but there is some level of oversight that the veterinarian has to have. So like the J5 vaccine is for E. coli, and so there might be reasons to use that if there's a lot of gram-negative mastitis or gram-negative diarrhea, things like that. All right, and we want to make sure when we're using vaccines that we are handling them appropriately so they're as effective as they should be. And we want to minimize their stress during times of vaccination so that they actually have the immune capacity to respond to those vaccines. Records we'll just jump through. It's really helpful to have individual ID, know who their dam, what their date of birth is. And then, once we can get permanent ID on them, have that all connected. Paper records, digital records, all fine. Oh, wrong kid. So for routine disease surveillance, that's where that permanent ID or individual ID is really important to help us manage those groups. So we want to make sure that it's simple, easy to understand. We don't want to collect more data than we're actually going to do anything with. It just makes it so we don't do anything with them. And then the treatment records are required for extra label use, just to know who the animal has to be identified, who has a withdrawal period that needs to be followed so that she is not being put into that milking string while she's been treated with something, if this is an adult animal. For kids, important because if we're selling animals to, if it's a buck kid that we've kept. So yeah, and then these records can be used to kind of help you and your veterinarian talk about your treatment program from the past year and if it was effective, your herd health program, and then what protocols you might need to adjust, because 1 year is not like the next, right? All right, so that is what I have. It was a lot of information. Hopefully it can be useful as a resource for you to talk with your vet about what types of protocols you might need to develop or adjust if you are seeing some of these diseases. And yeah, if I don't know how much time we have for questions, but yeah.
Yeah, we probably got a few minutes here. I know we schedule it till about 1:15. So if there are questions, you can type those in the chat box, or if you want to unmute, you can do that as well. As we're taking those questions, just a reminder that I did put the evaluation link into the chat box. So before you log off here today, if you wouldn't mind clicking on that and just filling out our evaluation for our webinar series, that's very helpful. We did have some questions on if this was going to be recorded. So just as a reminder, it is recorded, and then I'll do a follow-up email with the registered participants once that recording becomes available, and then it'll go onto our Extension Dairy Team website under our GOAT page. So you'll be able to access that back because there's a lot of great information here today, and I think it'll be a good one to review as we talk about those different disease challenges with our dairy goat kids. I did have one question that came in early on, and maybe it got answered because I think you did go through these, but just a question on what are the diseases CAE, CD, and T, and what is FAMANCHA. So maybe those were answered because I know you did those later on in the webinar here, but
Yeah,
maybe just
no.
maybe kind of just summarize those too.
Yeah, no, that's good. I'm guilty of all the acronyms. So CAE is caprine arthritis encephalitis virus. It's a lentivirus. It's related to the sheep version, which is OPP or ovine progressive pneumonia. They're small ruminant lentiviruses. They're also related to the human immunodeficiency virus. So that is what CAE is. CD&T is Clostridium perfringens type C and type D, and then T stands for the tetanus. So they're the 3 different forms of Clostridia that are in that vaccine. There are 8 ways that have those antigens that help protect for those bacteria as well as other Clostridial bacteria. And then I forget what the last one. Oh, FAMACHA is, I don't know what it stands for. It's a South African, developed in South Africa. It helps to identify animals that might be infected with Homunculus contortus, which is the barber pole worm. It basically is an indicator of anemia, so blood loss. Blood can be lost for other reasons, but it's pretty helpful for identifying animals that would benefit from giving a dewormer. So trying to move away from this blanket deworming that we tend to do and identify animals that actually require deworming. So good questions.
Yeah, and I
Can
see there's
kids,
another, yep.
yeah,
Can kids be born with floppy kid syndrome without nursing?
So I've seen weak kids born. It's probably not floppy kid syndrome. So floppy kid syndrome is usually the kids are older, they looked like they were fine, and all of a sudden they're down and out, and you can't really tell why. Kids that are born weak before they've even gotten up to nurse, it's probably something that was going on in the dough. So diseases like toxoplasma, chlamydia, campylobacter, those maybe even Coxiella or Q fever, those types of diseases that we typically think of causing abortions, maybe can, or if the doe is infected at a different period of time, or she just, for whatever reason, not only can it cause abortions, it also causes weak kids. You can also see weak kids if they were born early. So we saw a lot of that this year, it seems. We had some premature kids. So other reasons. And if those don't make it, then those are good ones to send for necropsies. Help answer your questions.
Dr. Busch, your conversation about records always intrigues me because that's the first fatal flaw when I'm in a cow herd or a dairy goat herd. What's been happening? And what's your thoughts on incorporating, for instance, PC dart and dairy comp, if we're already testing, making sure we're utilizing all the aspects that are out there? Do you find that helpful to dairy goat folks?
I only know, I'm trying to think. There are not many commercial dairies that I know of that are using those programs. I think it would be incredibly helpful. I mean, yeah, like you said, we're already testing. Maybe we're even doing daily milk weights, depending on what kind of parlor setup they have. But if we're not also looking, like let's take advantage of all that data and incorporate it with our health data to help us get a bigger picture. I think it's interesting to me, like even just abortions and things like that would be really important to be able to measure so we know from year to year what, is this an abnormal level? Yeah. A lot of times it's hard because we don't even know what our baseline is. So it's hard to talk to people about doing disease control for some of these diseases because we don't know where we are and what might, what the opportunity for improvement might be.
We have another question that came in. Did I hear correctly not to tube feed kids with no suckle reflex when you were discussing diarrhea in kids?
Yes, yeah, you did. Unfortunately, it seems counterintuitive because if they have a suckle, why aren't we just bottle feeding them? I will tube feed kids if they are chewing on my finger, so they're responsive enough to like chew. Maybe they haven't coordinated a full suckle. But if they're not even doing that, then I won't tube them. Because if they're weak enough to where they're not responsive to me being there or anything, then their stomach's also weak. So chances are if I tube them, it's coming right back up and down into their lungs. That's where these, honestly, like IV is challenging in these really dehydrated kids, even for a skilled veterinarian. But for those, it's would be so amazing for vets and producers to work together to develop these intraperitoneal protocols. It's amazing that gut has there's vessels all over the outside of the guts, and so it just gets absorbed from them so quickly. It's amazing. You see a response within a few minutes. It's incredible. So hopefully we'll be doing a webinar with AASRP in the fall, I believe, and we'll be talking about that with the practitioners.
Yeah, and just one comment here. I did put in a link. This is our Center for Food Security and Public Health. It's a very good website that I direct people to, producers to, because it talks about farm biosecurity and talking about disinfectants that are good towards certain bacteria and viruses. And I like it because it's broken down by species. So you could go and look into small ruminants, find out which diseases are more zoonotic. It's just a very helpful website that I want to just share out to the audience here if they want to take it and use it there. And I see we have one more question here about they're new to milk testing this year and they get their monthly samples analyzed and looking at somatic cell count. What number would you use to indicate an issue with milk quality?
That's hard. It really depends on what's going on with production and things like that, because goats can be kind of all over the place, but you'll see goats that are as low as 200 or 300,000. So I would be concerned if they're 1 million or more. There's something going on. Does it mean, like, do they have mycoplasma? I don't know. It could be a coag-negative staph that's a chronic infection that's keeping them that high. I think we tolerate 1 million, but I think a lot of that too is because we don't know a lot about these coag-negative staphs that cause subclinical mastitis and how it might actually impact their production. So I think, I don't know if you guys have anything to add to that. I think industry-wide we tolerate 1 million, but
yeah, and would you say the next step, and so now knowing what number they're working with, is to go back and sample and know what kind of pathogen they're working with to help better identify maybe the cause, if it's environmental versus contagious?
Yeah, I think that's a great
One
suggestion.
of the things that I will look at is go back the last 3 months. If that doe's been consistently 875, 975, 1,000, 1 million, okay, she is probably especially if she's a 6 pound a day. No, but if she was 250 last month and she's 1 million today, okay, flags ought to be going off everywhere.
Yeah, that's a good point. That's why it's nice to have kind of continuous data. Yeah.
Yep.
All right, well, we're just past 1:15 here, so I think we're going to wrap our webinar up here today. Appreciate Dr. Busch for you being on, talking about health challenges in our dairy goat kids. Covered a lot of great topics here, and like I said, it's very helpful to go back and review this webinar to kind of review those again. So appreciate everybody being on. And just a reminder that we'll be back in September, and we're going to be having a dairy goat producer panel for that webinar. So looking forward to meeting you all back here on September 21st. Have a good day.